Hello, and welcome to this week's episode of Psychology R Us. This is the show where psychologists from all around the world come to be interviewed by me, your host, the one and only Josiah Antonelli. This week we have psychologists that study in fields from mental illnesses to your own human defense mechanisms. Let's go ahead and introduce them. First, we have Dr. Brittany, who will be talking to us about defense mechanisms. Audience, if you would say hello to Dr. Brittany.
Hello, Dr. Brittany.
Next, we have Dr. Alyssa, who will be speaking to us about multiple personality disorders. Say hello, Dr. Alyssa.
Hello, Dr. Alyssa.
And after that, we will have Dr. Jeanette, who will be talking to us about bipolar disorders. Audience, say hello to Dr. Jeanette.
Hello, Dr. Jeanette.
And last but certainly not least, we have Dr. Cass, who will be talking to us about depression. Say hello, Dr. Cass.
Hello, Dr. Cass.
All right, well, let's get this started. First up, we have Brittany. Brittany, if you would come to the lectern, please. Hello, Brittany. How are you doing today?
I'm great. How are you?
Great. So you're talking to us about defense mechanisms. Can you tell the audience what exactly are defense mechanisms?
Well, that's a pretty broad statement. Defense mechanisms are the ego's protective methods of reducing anxiety by unconsciously distorting reality. There are hundreds of different defense mechanisms, but today I'd like to talk about 7 of the most commonly used in our everyday lives.
Okay, thank you. What are the most common examples of defense mechanisms?
Those 7 are repression, regression, reaction formation, projection, rationalization, displacement, and denial. Repression is an attempt to clear all anxiety-arousing feelings or memories from one's consciousness. For example, one who may have been severely raped or abused as a child will try their absolute hardest to repress the memory of it, but will still have a very hard time forming new relationships. Next, we have regression. Regression allows us to return to an earlier stage of development, meaning a nervous child on the first day of school might suck their thumb because they're so nervous. Another example of this would be a child who's never wet the bed before, but starts wetting the bed at an age that they really should know better. In reaction formation, your ego unconsciously does the opposite of what you're feeling, meaning if you strongly dislike someone, you might be extremely nice to them to cover up your true feelings. Then we have projection. With projection, we will try to conceal our own threatening urges and assign them to others. A better explanation of this would be like saying, she doesn't like me just because you don't like her. Necessarily, it doesn't mean she doesn't like you. You just think she doesn't because you don't. Rationalization is a defense mechanism that someone will use in order to explain their unacceptable behavior in a logical way. For example, a student that gets a bad grade on a test might blame the teacher rather than themselves because they didn't study. Next, there's displacement. If you have a bad day at work because your boss or coworker upsets you, then you might go home and take out your anger on your spouse, children, or pets. You normally take out your anger on someone you love because you know that they'll never leave you. Finally, there is denial. With denial, a person will reject the facts or seriousness of something because it is too painful to accept. A spouse might deny that their partner is having an affair because they don't want to believe it. Drug addicts and alcoholics will often deny that they have a problem, although it is very obvious to others that they do. Thank you.
Thanks so much, Dr. Brittany. If you would please have a seat. Next up, we have Dr. Alyssa, who will be speaking to us about multiple personality disorder. Dr. Alyssa, if you could come to the lectern. How are you doing today, Dr. Alyssa?
I'm well. How are you?
Very good. How are you? Okay, now you're going to be talking to us about MPD. What exactly is multiple personality disorder?
Multiple personality disorder, as defined by the National Alliance for the Mentally Ill, is a dissociative disorder involving a disturbance of identity in which 2 or more separate and distinct personality states, or identities, control an individual's behavior at different times.
Okay. Could you tell us about a few cases in which multiple personality disorder took place?
Of course. Sybil is a 1973 book and a 1976 film that tell the true story of Shirley Mason, who was treated by a psychiatrist with a special interest in multiple personality disorder, a Dr. Connie Wilbur. Dr. Wilbur treated her with sodium pentothal, which used to be used to help patients remember repressed memories. Many believe that Mason was faking everything, or at least exaggerating her situation as a child. Debbie Nathan, the author of Sybil Exposed, says that Wilbur paid this woman's rent, fed her, clothed her, all to get a glimpse of her personalities. Even when Mason attempted to tell Wilbur that she was lying, The young doctor was too hopeful to reach a breakthrough in her studies that she disregarded her apology as an attempt to get out of treatment. Syl was a controversial case, but if true, we can infer that abuse of a child can lead to this horrifying defense mechanism. Another case involves a woman by the name of Kim Noble. Kim Noble has 20 main personalities, many fragments, and 14 of the main personalities are artists. She's been sick from the young age of 14 years old. All of her personalities are artistic, though, much like Sybil, Kim holds none of these talents. Currently, she works together with her personalities to make a successful artist out of herself. She also takes care, full-time, of a 14-year-old daughter and supports her with money from her paintings. Cases have even been recorded where the victim believes they are an animal. In Dialogues with Mad Women, a 1994 film by Ali Light and Irving Seraph, a woman was filmed screeching and flapping her wings like a dragon. After thorough psychoanalysis, it was learned that this alter ego arose when she was hung upside down in a well as a child.
Wow, that sounds very serious. What are some symptoms that one with this disorder may have?
One would experience blackouts. In Sybil's case, they were years long. You would wake up in a place you don't remember getting to, with people you may not necessarily know, in clothes you don't remember putting on. In severe cases, personalities will harm victims' bodies, and the victim will wake up with scars they don't remember inflicting. One will also have anxiety attacks and nervous breakdowns quite often.
Okay, so what ways would a doctor treat this disorder?
A lot of times, psychoanalysis, or as Merriam-Webster would put it, a method of explaining and treating mental and emotional problems by having the patient talk about dreams, feelings, memories, etc., doesn't work in this case. Because psychiatrists are not actually speaking to the victim, him or herself, but an outward expression of his or her feelings. Hypnosis will bring out the victim, his or herself, and any of their alter egos. Sodium aminobarbital was removed from the market in 2000 and was stopped from being prescribed for victims of dissociative identity disorder in the 1970s. Also, after World War II, this drug was a kind of miracle drug used to treat psychiatric issues in and help bring back hearing and sight to veterans of the war. Currently, antidepressants, depressants, antipsychotic medication, anxiety medication, and stimulants are all used to treat multiple personality disorder, depending on the severity of the situation and their personalities, although all cases are considered serious. If anyone has or knows anyone who has DID, you should work to find a specialist of the disorder, much like myself. Or, if the case is severe and that the victim is getting physically hurt, they could need to be institutionalized.
Wow. Thank you very much, Dr. Ozer. Audience, if you would give her a hand. Next up, we have Dr. Jeanette, who will be talking to us about bipolar. Can you please come to the left? Thank you. How are you doing today, Dr.?
Very good, thank you.
Dr. Jeanette, what exactly is bipolar disorder?
There are actually 4 types of bipolar disorder. The main 2 are manic and depression. Over 5.7 million are diagnosed with this disorder, and this is according to the Institute of Mental Illness. So 2/3 of people know someone that has this disorder or have this disorder. And this disorder can be genetic. So if your parents have it, get tested. I want to talk about the 4 types of bipolar disorder today. First, we have a manic episode. The common signs of manic episodes are insomnia, that's when you cannot sleep throughout the night, anxiety, racing thoughts, and when you're highly distracted and impaired judgment. Sounds like ADD. The only difference about it is that bipolar disorder will only last a couple of days to weeks. Then we have hypomanic. It's the same as manic but less severe, meaning less days. Then we have depression. Most depression patients commit suicide, and the symptoms of depression consist of feeling hopeless and empty, fatigue and loss of energy, loss of appetite, feeling worthless and guilty. And then we have mixed episodes of bipolar disorder, and these feature symptoms of both manic and hypomanic, manic and depression. Common signs of mixed episodes include depression combined with agitation, anxiety, insomnia, racing thoughts.
Okay, well, could you give the audience an example of some famous cases?
Yes, actually, we have Ben Stiller, who was filming the movie Zoolander when he kept getting angry and anxious at everybody. And then we have another example, is Pete Wentz from The Fall Out Boy. He had a severe case of bipolar disorder. He actually fell hard on depression. He started hallucinating and had delusions. He also tried committing suicide by taking lots of pills.
Wow, sounds very serious. Are there any specific triggers or causes for this disorder?
Yes, this disorder happens when neurotransmitters send chemical messages between neurons and the neurons don't communicate very well or process like they're supposed to. For example, serotonin takes a big part of it. It is said that this chemical nerve affects the mood balance and can cause depression and other moods. Actually, stress takes a big part of it too. Stress can affect your thoughts and feelings and also your behavior. Substance abuse such as cocaine, ecstasy, amphetamines, and even over-the-counter medications such as cough medicines and even coffee can alter this disorder. Seasonal changes, for example, manic episodes are most likely to be on spring and summer, and depression and fall and winter. Also, lack of sleep can affect the brain, which can also trigger this disorder.
Okay, is there any forms of treatment that you could tell the audience that they could get?
Bipolar disorder requires a long-term treatment, but there's medications such as mood stabilizers like Lizabid, Tragadol, Lamictal can help stabilize emotional state and behavior. But before taking these drugs, talk to your doctor. We also recommend psychotherapy for those who encounter the state of depression more than others. They will help you cope with your problems, manage stress, and regulate your mood. We also recommend lifestyle changes such as maintaining a regular sleep schedule, avoiding alcohol and drugs, or anything that alters the brain. Minimize stress levels by doing sports or getting a hobby. Also keeping your sunlight exposure all year round. And last, of course, support. You need support from your family and friends. So if you know someone with this condition, have them give us a call at 1-800-273-TALK or go to our website at www.bpfamily.org.
Wow, thank you very much, Dr. Jeanette. If you would give her a round of applause. All right, up next we have Dr. Cass. Dr. Cass, you'll be talking to us about depression today. How are you doing?
I'm doing good, thank you, Josiah.
Very good. Tell us, what exactly is depression?
Well, we've all felt sad from time to time, but depression is much more than that. Depression is a mood disorder that causes a persistent feeling of sadness and general loss of interest. It is also called major depression or clinical depression. It affects how you feel, think, and act, and can lead to a variety of emotional and physical problems. People with depression may have trouble doing normal day-to-day activities, and it may make you feel as if life isn't worth living. Some people describe depression as living in a black hole, or having a feeling of impending doom. Some depressed people don't feel sad at all. They may feel lifeless, empty, apathetic, numb, or even angry, aggressive, or restless. Whatever the symptoms, depression is different from normal sadness in that it takes over your daily life, interfering with your ability to work, study, eat, and sleep, and have fun. The feelings of helplessness, hopelessness, and worthlessness are intense with little to no relief.
Okay, so how would somebody know if they have depression?
Well, a lot of my patients describe it as having a depressed mood during most of the day, particularly the morning. You may experience feelings of worthlessness, guilt, and helplessness almost every day, and hopelessness and or pessimism, difficulty concentrating and remembering details, indecisiveness and inability to sleep, or sleeping way too much almost every day. You'd feel a sense of restlessness or being slowed down, early morning wakefulness and irritability, diminished interest and pleasure in life and activities, overeating or appetite loss that lead to significant weight gain or weight loss, maybe persistent aches, pains, headaches, cramps, and digestive problems, sad, anxious, and empty feelings that don't go away, and thoughts or attempts of suicide.
Okay, could you tell the audience what would cause a sickness like this?
As with many mental disorders, a variety of factors are involved in the cause. Biology differences, brain chemistry, hormones, inherited traits, and major life events like death or trauma could result in depression. You may even have depression with no known cause. Researchers have identified certain factors that seem to increase the risk of developing depression, including history of anxiety disorder, borderline personality disorder, or post-traumatic stress disorder, abuse of alcohol or illegal drugs, certain personality traits such as having low self-esteem and being overly dependent on others, serious or chronic illnesses such as cancer, diabetes, or heart disease, as well as some certain medications like high blood pressure pills or sleeping pills can contribute to depression. Traumatic or stressful events such as abuse, the loss of a loved one, a difficult relationship, or financial problems, as well as blood relatives with a history of depression, bipolar disease, or alcoholism and suicide can contribute as well. Researchers in the area of mood disorders believe that chemicals called neurotransmitters are involved in depression. Nerve impulses cause the release of chemicals from one nerve cell or neuron to another, allowing cells to communicate with each other. Too less or too much of these important neurotransmitters may be released and contribute to depression. Some of the neurotransmitters thought to be linked to depression are serotonin, norepinephrine, and dopamine.
Okay, can you tell the audience, is there any way to prevent depression?
Well, there's no sure way to prevent depression. However, if you take steps to control stress, increase your resilience, and boost your self-esteem, you'll have a better time avoiding depression. Make sure to reach out to family and friends to help you get through tough times. Get treatment at the earliest sign of a problem to help prevent depression from worsening. Consider getting long-term maintenance like therapy to prevent symptoms from getting worse.
Okay, and if the audience were unable to prevent depression and already had it, how would you treat depression?
I would consider talking to your doctor or therapist about improving your coping skills and try to simplify your life. Cut back on obligations when possible and set reasonable goals for yourself. Give yourself permission to do less when you feel down. Write in a journal. Journaling, as part of your treatment, can be very beneficial and improve your mood by allowing you to express pain, anger, fear, or other emotions. Locate helpful organizations. Many organizations, such as the National Alliance on Mental Illness and the Depression and Bipolar Support Alliance, offer education, support groups, counseling, and other resources to help with depression. Employee assistance programs and religious organizations also may offer help for mental health concerns. Don't become isolated. Try to participate in social activities and get together with family or friends regularly. Take care of yourself. Eat a healthy diet, be physically active, and get plenty of sleep. Learn ways to relax and manage your stress. Examples include meditation, progressive muscle relaxation, yoga, and Tai Chi. Structure your time. Plan your day. You may find it helps to make a list of daily tasks and using sticky notes as reminders or using a planner for your day. Don't make important decisions when you're down. Avoid decision-making when you're feeling depressed, since you may not be thinking clearly. Many medications can be used to treat depression if coping methods aren't enough. Antidepressants affect the levels of brain chemicals such as serotonin and norepinephrine. Prozac, Lexapro, Celexa, Abilify, and Zoloft are some examples I would recommend. Without treatment, the physical and emotional turmoil brought on by depression can derail careers, hobbies, and relationships. If you find yourself in an emergency, please dial 800-SUICIDE or 800-273-TALK. Thank you.
Thank you, Dr. Cass. Audience, if you would give her a hand. Today we have informed you of the human mind's natural defense systems and three of the most common mental illnesses. We hope that if you are suffering from multiple personality disorder, bipolar disorder, or even depression, that you would take the necessary steps and doctor's advice to be able to get some help. Thank you for your time, and be sure to tune in next week. Next week we will be talking about the psychological differences between a human and a banana. Thank you.